The second program. The last program was an introduction on homeopathy, and today I'm going to actually be focusing on a specific topic. The topic that I'm going to be discussing today is on backache. I'm sure a lot of viewers are aware of this problem, and unfortunately a lot of women suffer from this problem, starting from teenagers to even old age. Before I continue with today's topic, I would like to let everyone know, especially those of us who have joined us today, that Holistic Health is a program where we will be discussing health issues in the perspective of homeopathy. Homeopathy is an alternative medicine which is about 200 years old, and it was developed by a German physician who was a homeopath himself. It was developed about 200 years ago in 1796. Homeopathy is a very gentle approach to treatment, treating many ailments, and we tend to use different type of substances that form remedies. Today I'm going to be focusing on backache, as I said, and the format of the program is that I have tried to break down the program into different segments. We will be discussing what the structure of the back is, where people can possibly have the problems, the pains, what is the smallest thing that you can do to cause a back problem, and what are the major reasons behind a back problem. I will also be letting you know different types of therapies that are available and out there that you can get in order to get some treatment for your back. And I will also be telling you the homeopathic and aromatherapeutic approach to the problem. You can call onto the program, and it's a live interactive program. You can talk to myself. Just a quick reminder to those of us who speak Urdu कि मैं उर्दू में भी बात कन्वर्सेशन कर सकती हूँ. अगर आप चाहें कोई सवाल पूछना, किसी भी किस्म की प्रॉब्लम डिस्कस करना चाहें, you can call me on the number that is available on the screen. हम उर्दू में भी आपसे डिस्कस कर सकते हैं. अगर कोई one-to-one conversation करना चाहते हैं, again you can call in the call center and we can have a one-to-one conversation. The whole point of me being on this platform is trying to educate people to different approaches of treatment that are gentle, that are readily available in UK, and approaches that can help you get rid of your ailments for a long term rather than just for a short term treatment. Now let's get back to our topic of backache today. Basically जो कमर दर्द है ये बहुत छोटी उम्र से भी स्टार्ट हो सकता है, which is normally teenagers for girls. टीनेजर्स में किस तरह बैकएक शुरू हो सकती है, जो कि समटाइम्स किसी को पता भी नहीं चलता कि doing little things can make you have a back problem. The first thing that is very, very important is your posture. You need to be aware of how you're standing, and there is a therapy called Alexandra therapy. Alexandra treatment basically it's a course over a few lessons that tells you to be aware of your posture and the way you stand, the way you sit, the way you lie down in bed, the way you get up from your bed. Obviously sometimes हम लोग इतनी छोटी-छोटी चीज़ों पे ध्यान नहीं देते हैं, but unfortunately अगर कोई इंसान over the long period of time सही accurate posture में खड़ा नहीं हो रहा, तो they can develop a back problem. So what I would suggest is, if you want to find out what is the right posture to stand, is if you lean yourself against a wall and you touch yourself against the wall from your heels and your lower back, and you raise your shoulders upright and you broaden them and you keep your chin straight and your head straight. The posture that you come into at that particular time, वो सही posture है जो कि आपका हर वक्त होना चाहिए. We get tired और हम इस तरह थोड़ा सा slaggy हो जाते हैं, थोड़ा lean either sometimes to the right, sometimes to the left. We all have a different stronger side. कुछ लोगों की right होती है, कुछ लोगों की left, and we tend to lean on that side more rather than keeping our whole weight into the middle. So the first thing to avoid a back problem is to basically have a good posture to stand, to sit, and also when you're in your bed, you make sure that you lie in the right posture. जिस वक्त आप बेड में होते हैं, it's very important to have a right mattress, it's very important to have a right pillow. Your pillow should not be too high and it shouldn't be too low down. It should be very thin, it shouldn't be very thick, just about the right measurement. Your mattress should be at least 2 centimeters thick or more. There are specialist mattress. जिन लोगों को बैक प्रॉब्लम है उनके लिए मैं सजेस्ट करूँगी कि वो ऑर्थोपीडिक मैट्रेसेस का यूज़ करें, क्योंकि अगर आप ओवरनाइट स्लीप हेल्थीली करते हैं और रिलैक्स स्लीप करते हैं, आप अपनी बॉडी को, अपने मसल्स को, अपनी बोन्स को चांस देते हैं कि वो रेस्ट करें ओवर द नाइट, देन ऑब्वियसली यू विल फील कि जब आप सुबह उठेंगे तो आपकी डेली रूटीन में, आपकी डेली एनर्जी में काफ़ी डिफरेंस आ जाएगा. बिकॉज इफ़ यू हैव अ रेस्टफुल नाइट you tend to have a lot more energy in the morning to do your daily things. If you're working to go and work, if you have your housewife, if you're at home to do your house chores. Now let's understand one thing is now clear. I will just summarize it, that your posture is very important. If you want to help yourself with the back problem, first thing anyone's going to tell you is to have a good posture. Try and make your posture better. In start it's going to be very difficult, because any change in human body is difficult to adopt and it takes time, it becomes tiring in the start, but once you get used to it, uska aapko fayda bahut hoga. So it's better to suffer a little bit of uncomfortable situation in the start. The second thing is कि आप understand करें कि where exactly you're having pain in your back, so you could tackle that particular point in your body, क्योंकि throughout your whole spinal cord, जहाँ पे different जगहों पे दर्द is a sign of different type of problems. So I'm going to explain you where the backbone starts. कमर जिसको हम रीढ़ की हड्डी कहते हैं उर्दू में, it starts from the back vertebra of your neck. So जो आपके जहाँ पे आपका हराम मगज़ होता है, अगर आप वहाँ पे जाएं, right at the back of your neck, आपके sometimes that's the part that goes in the where your hair is finishing, वहाँ से आपकी backbone start होती है. And it goes all the way down to your pelvis muscle, the very back, just near your buttock, just near your hip bone. It runs through your body. So इसको आप ऐसे समझें जैसे किसी दरख्त की शाख है, तना है. It's a stem of a tree and the tree is standing on its stem. So अगर इंसान की backbone strong होगी, you will be a much more healthier person overall. लेकिन अगर आपकी back strong नहीं है, अगर आपकी backbone strong नहीं है, you will suffer in many ways. It can cause disturbance in your gynecological problems. It can cause problems in your pelvis area, where you normally tend to have your womb, your ovaries. It can cause problem in your digestive area, जहाँ पे आपका stomach आता है. It can cause in your urinary system, जहाँ पे आपके गुर्दे आते हैं. And it can even cause you lung problems, where your breathing system comes in. And then obviously it can cause you side problems right at the top of the neck. So it can disturb you in so many ways. So it's such a crucial part of your body that you need to take care of. Now back को normally we divide in 3 parts. पहला हिस्सा जो है वो है गर्दन or shoulders. दूसरा हिस्सा जो है that is starting from your lungs, chest part, and down to your abdominal area, and the last part is where your uterus is and down pelvic area, and the main big bone is the tail of the bone is is at the back of the pelvic bone. The most important one, और जहाँ पे सबसे ज़्यादा especially औरतों को problems होती हैं to do with the back, is the one that is just behind your pelvic, the last part. It's the most sensitive part for a woman, and that's where a lot of women experience the problems. Now I'm going to go one by one what to do for which particular part, or किस किस्म के treatments they are available, and what things you can do, just like simple little things जो आप घर में कर सकते हैं to help you. So let's think about it. I've mentioned already the bad posture. Obviously, that is the main cause of having the back pain. So having a good posture not only will lift you up as a being, and it will put good energy around you, and you will be feeling uplifted and light if you practice it over a period of time. It will also help you get rid of your pains if they are acute pains, and also avoid them becoming chronic or long-term back pains. Now, any pain that is about 6 weeks, 3 to 6 weeks old, I would say कि वो एक, you know, maybe it's because आपने कोई भारी चीज़ उठाई है और भारी चीज़ उठाते वक्त आपने ध्यान नहीं किया. Don't jerk yourself, like don't just pick up anything and, you know, just walk off, or don't just unconsciously put your weight on one side and pick up something. Whenever you're picking something heavy, doesn't matter what age you are, always first be firm on your both feet. Put your weight on both feet. दोनों पाँव के ऊपर आपका weight बराबर का होना चाहिए, and then try and lift up. Have a good grip of the object and then try and lift it up. That can help you make sure that you're putting a steady weight on your back, which is spread throughout the back, and you're not concentrating on one particular part. It's quite obvious अगर आप over a period of time किसी एक body के हिस्से को use करते रहेंगे, it's gonna wear out. So this is how back works. If you're gonna be putting your weight all on the right hand side, you're gonna develop a problem on the right hand side towards the right, and you will have problems in the right leg, in the right arm, you know, similarly vice versa to the left side. So it's better to disperse your weight evenly on both sides. That's the most important thing. When you are getting out of the bed, make sure कि आप एकदम से नहीं बेड से उठे. Take your time and do not just spontaneously get up. Extremely important, and we don't care about these little things. We unconsciously tend to do things very quickly, very fastly, but they do affect you in the long run, especially if you're someone who has already developed concerns with the back. Now, let's talk about the home remedies that you can do. A very good remedy is having a water bottle. जिस वक्त भी आपको you develop a back pain, the very good remedy would be कि आप गर्म पानी की बोतल कर लें, and you can place it on the area, you know, anywhere you're having problem within your back. For some people, however, मैंने देखा कि ठंडी चीज़ें ज़्यादा उनको relief करती हैं pain. So you can have you know, a cold frozen bag of vegetables or something. Just wrap a paper, a bag around it, or and just put it where you're having problems. So it will soothe the pain. And remember, it's just a temporary way of getting rid of the pain or easing the pain. It's not a permanent solution. Now, I was saying earlier about the duration of the pain. अगर तो आपकी back pain has lasted about 3 to 6 weeks, it's very important that you, once you know it's lasted about 3 weeks, I would suggest कि आप अपने GP के पास जाएं, आप अपने local health center पे जाएं, and you report it to them that you're having a back issues. They should address it straight away. Normally they would give you some painkillers, but unfortunately painkillers will not help you get rid of the pain. They will completely and eternally, it will just be a short-term sort of way of easing off the pain, but it will not resolve the issue for long term. So it's very, very important that you do seek other approaches that are available outside that region, you know, to help you get rid of the pain permanently. As I said earlier, there are a lot of therapies which are available. There is osteopathy, there is acupuncture, there is chiropathy, yes, there is chiropractic, and there is also homeopathy, there is aromatherapy. The one I'm going to be concentrating today is homeopathy and aromatherapy. So I will be giving you some remedies that you can use, and I will also be telling you some oils that you can use. So make sure that you have a pen and a paper handy to write it down. I'll also be telling you how to take them and how often to take them. Now, we'll come back to the duration. As I said, about 3 weeks. It's a lot. You know, it's the first bell ringing. You need to address it. Go to your GP. Get your GP to check it. If, for example, it was just a strained muscle, or you pulled your muscle, or it was just something out of the blue, there's a high possibility that making your posture better using some home remedies, the oils that I'm going to tell you, it may relieve the pain. However, अगर 3 week के बाद भी आपकी दर्द जो है वो ठीक नहीं हो रही है, then it means it's maybe something that you need to address in more detail. Then I would suggest that you go to your doctor. The way you can diagnose, there are very specific screening ways to diagnose your back problems. अगर तो आपके टिश्यूज़ में या मसल्स में कोई मसला है, a CT scan will definitely show up what the problem is. A reflex check will also tell the doctor where exactly the problem is lying. Also, अगर आप अपने डॉक्टर से कहें कि आपका MRI स्कैन या एक्सरे कराए, उससे भी जितनी अगर हड्डी में खुदा ना खास्ता कोई मसला है तो वो आपका शो अप हो जाएगा on an MRI scan or an X-ray scan. So these are the approaches you can take, but then again you will have to go to your GP to get a request sent to hospital and a referral on your behalf to get these tests done. Once you have had a test and unfortunately you find out कि कोई मसला है back में, then you need to decide your your options that you have available. Physiotherapy is a very gentle approach that works over over a period of time. अगर आपके muscles stiff हो गए and you're unable to use a particular muscle in your body, जिसकी वजह से एक muscle अगर नहीं use हो रहा दूसरे muscle पे ज़्यादा strain and that's why you're developing a pain, तो physiotherapy is a good approach. Now, as far as aromatherapy is concerned, there are a few oils that you can use, but I want you to be very, very careful in using them, and I would like you to follow my instructions. It's exactly as I say if you wish to use that approach. There are a few oils, but in order to use those oils, first of all, you need a base oil. A base oil is basically anything that you can use to massage into your body. You can use Baby Johnson's oil if you haven't got anything else at home. But I tend to use, अगर गर्मियों का मौसम है तो I tend to use almond oil. और अगर सर्दियों का मौसम है तो I tend to use, which is obviously we have here, olive oil. But make sure you get a pure olive oil. Now, what you do is maybe get 2 tablespoons of any of those base oils जो मैंने आपको बताए हैं, और उस base oil के अंदर आपने डालने a few drops. I tend to use ginger only because ginger has very good anti-inflammatory characteristics to it, or antioxidant भी है ginger जो है, इस वजह से I like to use ginger. But if you don't like the smell of the ginger, then there is another one which is rosemary. So ये oils जो है आपको you can find them from any health shop, any big pharmacies. If you ask them for essential oils, you will be able to get these. They are very, very strong. So, and make sure you keep them in a dark room, in a dark place, जहाँ पे light ना पहुँचती हो. You need to keep them in a cool, dark place. So what you need to do is maybe in a small bottle, you put 2 चमचे आप डालें base oil के. बेस ऑयल बादाम का तेल, आलमंड ऑयल या ऑलिव ऑयल, इन दोनों में से कोई भी आप ले सकते हैं. 2 टेबलस्पून डालें, उसके अंदर आपने डालने हैं few drops which is about 3 to 4 drops. या तो जिंजर अरोमा ऑयल के डाल लें या फिर रोजमेरी अरोमा ऑयल के few drops आप उसके अंदर डालें, and then you just shake it, उसको अच्छी तरह से हिला के. If you want to have a warm effect, अगर थोड़ा सा आपको गर्म अच्छा लगता है तो just put it in a microwave or on a pan, on a stove, थोड़ी देर के लिए पैन में डाल के उसको थोड़ा सा हल्का सा, बिल्कुल इतना कि जो आप स्किन पे लगा सके, don't make it too burning hot, इतना उसको गर्म करके, and then you just massage. And if it's somewhere in your back, especially the lower back, then I would suggest get someone to massage it for you, and lightly, maybe for 10-15 minutes, get a good deep massage of it and rub it in your skin. You will see that the oil will kept on absorbing in your skin. और उसके बाद what you need to do is maybe just wrap yourself around with a warm cloth or something and just take some rest for a while. Doing that practice over a period of time, you will see that it will start to release the stiffness and the inflammation of your muscles and your bones. Especially ginger will work really, really well on it, where the inflammation is the problem. Inflammation जिस तरह के सूजन हो जाती है, और tension of muscles, खिंचाव, especially a lot of people have tension in their shoulders, so it's really, really good. Rosemary is really good. If you want to be extra relaxed, so this is specifically for women who are very hardworking and they exhaust themselves up because of the daily heavy routine of work, or very busy housewives. I would suggest you to put about 1 or 2 drops of lavender. This is only for if you wish to relax. And you really want to, maybe you want to, just before going to bed, you want to go into nice deep sleep. Then you can put about 1 or 2 drops in the same oil. जिसके अंदर आपने, for example, अगर आपने almond oil use किया, so almond oil, ginger, 2 tablespoon almond oil, 2-3 कतरे ginger के, 2-3 कतरे lavender के. ज़्यादा ginger रखना है, कम lavender रखना है, because ginger is there to help the inflammation effect. It's working as an anti-inflammatory, and lavender is there to soothe you down mentally. So lavender डालना, lavender की खुशबू से you will feel very relaxed. So what you need to do is उसका mixture बना के same way उसको गर्म करके लगाएं. You will feel relaxed, you will feel the tension releasing from your body, the muscles becoming less inflammatory, less tense. If you take a hot bath, then you can also put the same oils. You don't need to use the base oil then, क्योंकि पानी, there is water there in a big amount, for big dilution. So all you need to do is put a few drops of the same oils in the water tub, and you can take a hot bath there. That will help you ease off the inflammation and the stiffness in your back as well. This is the ये जो अभी मैंने आपको बताया, ये this is the aromatherapeutic approach. This is using the aroma oils basically. I will be giving you some homeopathic remedies as well, but I just want to tell you one thing here and just make you aware of the fact that the remedies I'm going to be giving you are for very acute purposes. And as I said yesterday, the first program जो मैंने किया वो इसीलिए किया था कि when I'm going to be using these terms, acute, chronic ailments, I want people, I'm sure you all are, but there's just those of you who are not, I want you to be aware कि what am I talking about. So by acute, I mean anything that is temporary. Like for example, I woke up in the morning, I've got flu and my head is heavy. This is acute. Now if I let it go on for about 2-3 weeks or maybe a month, it's going to become chronic. So if you have a back problem, जो कि maybe 2-3 week तक, it's about a week and a half is going to be acute. लेकिन अगर उसके बाद वो persistent है and it's getting worse and worse and the symptoms are not getting better, so it will turn into a chronic problem. Now the remedies that I'm going to give you are going to be acute. जैसे आपको straight away कोई मसला हुआ है, anyone who has उसका आपको muscle pull हो गया, आपको tension हो रही है because you've been working in front of a computer, you've been driving for a long period of time, you've been lying in your bed for a long period of time, or sitting down for a long period of time, or standing for long time, then these are the remedies that you can use to ease off the pain. But if you're someone जिसको बहुत ज़्यादा अरसे से ये प्रॉब्लम है और ये प्रॉब्लम persistent है and it's affecting your daily routine और आपकी ज़िंदगी में आपको ये bother कर रही है, then obviously just having this remedy is not going to make much difference. You need to have a proper consultation. You need to see a homeopath and discuss your case. They will ask you so many questions, because one thing about back is it's very important to find out कि exactly कहाँ पे दर्द होता है, किस तरह का दर्द होता है, the sensation of the pain, और किस वक़्त में होता है. It's very important to find that. And obviously हर एक के symptoms के लिहाज से उनकी medicine change होएगी. So just take it down for emergency, like if you need something instantly and it's acute symptoms, then I'm going to be giving you some remedies. A very famous one that we use in homeopathy is Rustox. So agar for example because of heavy strained activity आपके हड्डियों में दर्द हो, especially the backbone, so you can use Rustox. Arnica is another one. Arnica is very good for shock. So for example, a lot of people tend to have neck and back pain as a result of a whiplash injury. Agar aapko, you've been involved in a road accident or any sort of activity that's caused you to whiplash, and it's been such a it's been an immediate shock to your system. Not that it will help you. Arnica, the spellings are the following: ARNICA. Now this remedy Arnica, not that it will help you to release the shock physically, but also mentally. So this is another very good remedy. There are a few more. There's Bryonia, and there's hypericum, which are very specific sort of pains with your muscular skeleton system, your bones, your backbone, your knee bones. So all these sort of pains can be eased off, but as long as they are only acute problems. All these remedies you can get, you need to get in 30 potency, which is a very mild potency. Again, it's it's a generic one. You can find these remedies on counter in any health shop. All these remedies are available. I've been out there myself and get those, so that you can get them from any major outlet out there, any major health shop. You will be able to get these remedies from there. And they're not very expensive as well, so it's good to have them handy at home, at the times when you may urgently need them. So these were the homeopathic remedies, or aromatherapeutic approach to your back problems. As I said earlier, अब हम लोग और भी different चीज़ों में जाएंगे. I have a plan to discuss the different types of back pains that you can have, different times in your life when you can develop a back pain also. Let's talk about the signs that you can first gain. कि जब आप कोई back problem develop करता है, तो पहले क्या signs उसको feel होंगे? So if you are someone who has lifted up something heavy again, who has had a whiplash injury, in pregnancy you can develop a really bad back pain. So what would be the signs that it's going towards a serious diversion and you need to address the issue? If you feel that आपको temperature बहुत ज़्यादा हो रहा है, that tells you that you need to address the issue. If you start losing weight very quickly, that's an alarming sign as well. Now I'm just going through the list of symptoms that you could have along with a heavy back pain, and the back pain could be anywhere from the neck, the shoulder, just below the shoulder, your lower back, and then your pelvic area, the last vertebra. So anywhere around that area, अगर आपको पेन है, स्टिफनेस खिंचाव है, या स्वेलिंग है, सोजन है, और जिस तरह कोई टच भी करे प्रेशर से भी you feel a lot of pain, then these are or plus you have any of these symptoms, then that means you need to address it. Please do not let it go. There's swelling, as I said, there's constant pain, and the pain that does not ease with anything, nothing is relieving. So for example, sometimes अगर किसी को back pain होता है, तो अगर आप थोड़ा सा rest लेते हैं, it's tend to ease off. I know, some people, if they start having back pain with doing exertion, लेकिन अगर एकदम से they start taking rest, maybe for 10-15 minutes they sit down, they take rest, ease off हो जाती है पेन. बट इफ़ you're someone जिसकी दर्द ease off नहीं हो रही है ये सब कुछ करने के बावजूद, then it's alarming. You need to pay attention to it. If the pain is persistent in the limbs, the lower limbs, just below your knee, then that's problematic. You need to address that urgently. And very, very crucial point, and unfortunately this is quite serious. So if any of you is suffering from back pain, or jiska ye masla which has got to this point that I'm just going to mention, then please do seek some advice urgently. If you're having back pain with the loss of control to your bladder or your bowel muscle, then it's something very urgent. So अगर you're someone जिसको बैक पेन के साथ साथ उनके मसाने पे उनका कंट्रोल नहीं है, and you tend to lose control when जब आप यूरिन पास कर रहे हैं, so you need to address the issue. That means that the pain or the issue is spreading in your nerves and the muscles that are controlled by the nerves as well. So it's something really serious that you need to address. If you have pain that goes really bad during the night, again that's something that you need to address, because दिन में जब आप काम कर रहे हैं, you are having a very high level of movement, it's obvious to have a pain. लेकिन जब आप रात में even rest कर रहे हैं but you're still having a pain, that's problematic. You need to address that. So even having a pain while you're resting is alarming, and you need to address that basically. Okay, so let's talk about how we can sort of avoid the pain from scratch. What things you can do to try and avoid them completely. So now I'm going to give you sort of tips that you can probably follow ताकि आपको back problem का मसला ही ना हो. There are issues जिसमें you can't avoid back pain. For example, अगर किसी का traffic accident हुआ है, कोई गिरा है, then you're meant to have it, and it's supposed to last a few weeks or months. But if it's come because of you have lost weight, or you're having pain in your kidney region, you're having pain in your digestive region, जहाँ पे आपका मैदा होता है, पेट वगैरह जहाँ पे है, वहाँ पे पेन की वजह से पीछे बैक में स्प्रेड हो रही है, किडनीज में की वजह से स्प्रेड हो रही है, या आपके जहाँ पे you have your ovaries and womb, वहाँ पीछे रीजन पे हिप बोन पे और बैक में जा रही है, पेल्विस से होती हुई, then these are the issues which are very alarming. Then there is something deep inside that is not right. So having a back pain, for example, in pregnancy is usual. It's a normal thing. But again, don't let it go for too far ahead. But there will be, it's quite unavoidable. But as I said, having homeopathic remedies during your time of pregnancy can actually help you ease off the pain. So agar aap homeopathic remedies, there are actually kits available out there, and maybe in my next programs I will bring those to the program, and then if you wish to have one of those, you can actually call our call center, and you can have one of those kits which are very useful during the period of pregnancy, and they have all different type of remedies from helping you during your pregnancy all the way to after childbirth and during the labor as well, that you can take to ease off the whole painful procedure. Now, as I said, in pregnancy, if you're having pain, taking one of those remedies will help you to ease off the pain. But again, it's acute. Do not be in an impression that you're going to take those remedies and the pain's completely going to go away. It's not going to happen all the time, because as I said, every individual is different, and these remedies are like for acute, they are for anything जो foreign आपको problem आई है और आप उसको foreign treat करना चाहते हैं, any problem जो कि long term problem है, these remedies alone by themselves will not be sufficient. So let's talk about how we can actually avoid the pain from scratch, how to not to have basically back pain, what things you can do. One thing I mentioned earlier was the posture. Please ladies, make sure that your posture is right when you're sitting. I know we all tend to sort of go deep down into our chairs and our settees, but it's not a healthy way of sitting. When you do sit, make sure you sit upright, you keep your chin straight, you keep your neck should be straight up, your head should be straight, all at the perpendicular to the ground level, as in straight 90 degrees to the ground level. When you stand, make sure you join your both feet and you stand straight. Do not try to lean on one side or the other. That can weakening one side of the muscles and then causes you problem. So when you are stand straight, sitting down, you make sure you put your legs and knees together and you put your feet together. Very important. When you're driving, it's extremely important to make sure that your seat is adjusted properly. That will allow you not to do your driving comfortably and securely, but also to avoid back problems, and especially if you're someone who drives for long journeys. When you're working in front of a computer, it's extremely important to make sure that your keyboard, your screen, your seat adjustment is at the right levels, and it's not straining your eyes, it's not straining your back. Extremely important. Regular use of the aroma oils. If you are a working woman, maybe twice a week, using them in a bath or massaging them, especially in your shoulder area, will actually help you ease off the pain as well. So what you can do is, posture is number one. The second thing is, if you are over on the scale of being overweight rather than being healthy weight, then losing weight also helps you to get the right posture. Not that just your posture improves by having a healthy weight, but you also tend to see that the pressure on your skeletal system also reduces down, which allows you to then maintain your weight equally on both sides, and it gives you a chance to sort of recover your whole skeletal system and get rid of the pains over a period of time. So making sure that you maintain your weight is also very good. Having a healthy diet is another way of dealing with the back pain, and I will go into more depth later on in the program why am I focusing on healthy diet, how that can affect your back pain, because unfortunately back pain is also a secondary symptom. It's not necessary some people are just dealing with the back pain. They may be suffering from something else that causes the back pain as a secondary effect. So we also want to make sure that other ailments that have a secondary effect of back pain, that can be resolved as well, and some of them are dependent just on healthy diet and healthy lifestyle. As I said, a good walk, you should be, how to avoid having back pain is the key to it is being active. And I'm not saying putting yourself through strain and going through the heavy workout, no. I'm just asking you to be active, as in just do 30 minutes walk daily, swimming, cycling, just little exercises and being active. There was used to be, पहले जिस टाइम वक्तों में ये होता था कि अगर किसी को बैक पेन होता था तो they were used to rest करें, आप लेटे रहें, बैठे रहें, but it's not the case. The research shows कि अगर आपको back pain है तो it's better to be a little bit active. जैसे कि अगर आप थोड़ा बहुत ऐसी मूवमेंट करेंगे, मतलब चलेंगे फिरेंगे हल्का हल्का सा, ऐसा काम जिसमें आपकी बॉडी को स्ट्रेन ना हो, लेकिन यू स्टिल मूविंग योर मसल्स एंड योर बोन्स, ऐसे काम से एक्चुअली ओवर अ पीरियड ऑफ टाइम आपको लेस फील होगा बैक पेन. So and even anywhere in your body, your knees, your arms, anywhere, all the bones, you will feel relieved from the pain if you keep your muscles going. And it's quite simple logic behind it. Think about it. अगर किसी की कमर में दर्द है और वो 10 दिन लेटे रहे हैं, and then when they're going to get up all of a sudden, obviously you're going to feel more pain. But whereas if you're someone they were doing a little bit of movement throughout, then over a period of time you're going to be someone who actually is going to suffer less than the person who has just been resting. So it's common sense. So be active even through the period of the pain, but do not strain yourself. I'm not saying lift heavy things. I'm not saying do extensive exercises. I'm not asking you to stand up for a long time or sit down for a long time. I'm just asking you to please be a little bit active, do gentle walks and gentle activities to help you relieve the pain. One more thing, and the most crucial thing, and especially in homeopathic perspective, is to be positive. And I have seen, because and it's not really it's not us, it's the part of the body back it's such a crucial part. It's on which we stand. It's basically the stand of the body. It helps you to be it helps you to stand, it helps you to walk. It's the backbone, and there's a reason why it's called the backbone. Your whole body is dependent on that one part in a way. And if you have pains and aches in that part, obviously it makes you feel down, and you feel like पूरी body में energy नहीं है, even though आपके बाकी सारा system ठीक हो सकता है, and just your back pain can let you down and have such an adverse effect on you. But you can help yourself by making sure that even through this period of difficulty of having, you know, a bad back, you can keep your chin up and you can think positive about yourself, about other things around you, about life in general. Because as I said in my last program, हर चीज़ जो जिसमें physical effects होते हैं, that has a mental effect and emotional effect on your body as well. और physical तो फिर भी recover हो जाता है. The mental effect and the emotional effect takes very long time because they tend to have a more stronger memory than the physical body. So it's very, very important कि आप एक छोटी सी problem, you know, don't take as if I'm making it very light. I know those of you who suffer from back problem, it can, you know, it can be a major obstacle in your daily life. But I'm just trying to help you here, and I'm, you know, telling you that if you be positive about it and try and sort of deal with it, of course, by professional help, but just keep it at the back of your mind and try and live as normal life as possible. You will feel that it tends to sort of fade away, and it will help you to recover much more quickly out of that period of pain. So having good mood, you know, and having a positive energy around you will definitely help you tackle the pain. As I said, regular activities, Pilates and yoga is something really good. Pilates classes actually allow you to build your strength and to also build your stamina. So it's really, really good to try yoga and Pilates. Now, you need to try and reduce your anxiety. Do not be stressed about the whole experience, even though it is a stressful experience, but try to keep yourself calm. And again, there are homeopathic remedies that can actually keep your anxiety low while you're suffering from a pain. So we don't, as I said earlier, we're not just treating, we're not just focusing on your pain or one particular part of your body. We're actually trying to treat you holistically. So at one particular time when you go to see a homeopath, the homeopath's aim is not just to get you recovered from the ailment that you're suffering from. एक अच्छे homeopath का ये you know, it's their responsibility कि वो आपको holistically treat करें. So when you go to a good homeopath, वो आपको उस चीज़ की भी रेमेडी देंगे जिसके प्रॉब्लम के लिए आप उनके पास गए हैं, बट एट द सेम टाइम वो आपको एंजाइटी के लिए, स्ट्रेस के लिए, मेंटली, इमोशनली, in so many different ways, therapeutically, they will treat you in one particular time. So these are the benefits of homeopathy, and that is the reason why I'm here on this platform, to try and help people using a more holistic and a gentle approach. One thing you can also do is avoid sudden movements. As I said, don't do anything spontaneously. It doesn't matter how young you are, even if you're, you know, in your early 20s, it's good to take time. कुछ भी heavy उठाने से पहले, बैठने से पहले, उठने से पहले, just take your time. Just don't do rapid, spontaneous movements, because sometimes your mind may be ready to do something, but your body may not be. So give your body a time, just a moment of time as well, ताकि वो भी ready हो जाए to do the same thing that your mind is willing to do. One very good remedy to avoid back pain is wearing the right level of heels. We all love wearing high heels, but unfortunately a use of very high heels, and by very high heels I mean about more than 2.5 inches, in long run can cause you a lot of problems. It is very ideal to wear just about half an inch of heel, but if you are someone who cannot avoid heels, definitely go for about half an inch or inch heel. But if you can avoid them, flats is probably better, especially through the period when you are suffering from the back pain. Flats will definitely help you, and once the pain eases off, then you can go on to wearing just a little bit of heel. But occasional use of high heels is maybe fair enough, but routine use of high heels is not very practical at all. It can cause a lot of problems, not just in back, but also other deepened problems as well. So it's better to avoid it, especially if you're wearing it as a routine over a period of time. Occasional ones here and there should be okay. All right. I have already addressed you that sleeping is extremely important. You need to have a very good mattress, especially if you are already suffering from back pain. It's good to have an orthopedic mattress. You can get them easily from any furniture shop. You know, it's good to have a good pillow, because neck is related to your backbone. As I said earlier, your backbone is not just one particular part. We tend to think कि backbone सिर्फ कमर का हिस्सा है या lower back का हिस्सा है. No, जो रीढ़ की हड्डी है, जो आपकी you know, the whole stem made up of small little vertebrae start all the way from the back of your neck, and it goes all the way down to behind the pelvic bone. So these are the precautions that you can take. Now I'm going to go further into depth about किस किस्म की different types of back pains हो सकती हैं, and where about do they occur. A very common one जो कि unfortunately बहुत सारे लोगों को, especially मर्दों में भी पाई जाती है, but ज़्यादातर औरतों में जो पेन पाई जाती है वो है sciatica. Sciatica pain is basically जब आपकी रीढ़ की जो हड्डी है वो छोटे छोटे हिस्सों, you call them vertebrae, उन छोटे छोटे हिस्सों से बहुत सारे छोटे छोटे joint हिस्से होते हैं, वो मिल के बनाते हैं, और उन हिस्सों हड्डियों के दरमियान के अंदर spongy, like a sponge layer, like a jelly spongy layer होती है round. So that spongy layer is your disc basically. So what happens is, through your backbone runs your main nerves, जिसके अंदर आपके blood की supply होती है, starting from the neck all the way down, and then from your pelvic bone, जो आपके बिल्कुल आखिरी हिस्सा है जहाँ पे where your hip bone starts, the right outer side of your backbone in right lower back, वहाँ से वो दो हिस्सों में you know gets divided, दो हिस्सों में चली जाती है, the right leg and the left leg. Now what happens is, जो sciatica पेन है उसके दौरान क्या होता है कि आपकी right leg या left leg जो होती है, उसके जो vertebra होता है वो swell कर जाता है, उसके अंदर inflammation पैदा हो जाती है, और वो inflammation पैदा होने की वजह से जो nerve उसके through चल रही होती है, जो कि that runs down your leg, that gives you sensation basically, जिसकी वजह जो आपको वो सिग्नल्स देती है कि आप अपनी टांग हिला जुला सकते हैं, वो नर्व जो है वो डिप्रेस होती है. जब हड्डी फूल जाती है और उसको दबाती है तो वो नर्व डिप्रेस हो जाती है, और उस नर्व के डिप्रेस होने की वजह से यू फील पेन. इट्स जस्ट सिंपल थिंग एज दैट. A lot of people tend to have a left one, but you can also have a right one. अब वो जो नर्व डिप्रेस हो जाती है उसकी पेन की वजह से आपकी पूरी टांग में नीचे तक दर्द रहती है. In start, it can be just little pain, but over a period of time, it can become quite bad. It can cause you numbness. आपकी टांग में बिल्कुल फील करने की हिस्स ख़त्म हो जाती है, टांग भारी हो जाती है, and eventually you can lose the control of the leg. You find it very difficult to maneuver with using that leg, unfortunately. So this is the type of pain that is the sciatica pain. So it's the swelling in your backbone, जो backbone में सोजन हो जाती है, उसकी वजह से actually आपकी हड्डियों को कुछ नहीं हो रहा होता. It's the nerve that gets depressed, and then that causes the problem. See, the thing is, it's all related. Our body is so complex कि अगर एक चीज़ disturb होती है, the whole system, you know, something else has an adverse effect on it. The second thing, which is again very common one, and again gents suffer with it as well, but also ladies do it too, is slip disc. As I said earlier, कि जो vertebrae है उनके दरमियान के अंदर जो spongy layer रहती है, उस लेयर के अंदर बेसिकली क्या होता है कि उस लेयर के अंदर आती है आपकी खून की सप्लाई, और वो लेयर और हड्डी बिल्कुल साथ साथ होती है इन एवरी वर्टेब्रे थ्रू आउट द होल बैक, और वो जो खून की सप्लाई है वो सारा कुछ जो न्यूट्रिशंस और अच्छी एवरीथिंग दैट योर बॉडी नीड्स वो हड्डियों को वहाँ से सप्लाई करती हैं, और हड्डियों में जो सेल्स होते हैं वो ओवर द पीरियड ऑफ टाइम दोबारा से रीजनरेट होते हैं, नए सेल बनते हैं, एंड दैट्स हाउ यू सॉर्ट ऑफ ग्रो अप एंड यू कीप योर बोन स्ट्रांग. Now, अगर जो disc है वो slip हो जाती है from right to left, or dispositions itself, it can be any way, forward, backwards, right to the or the left, in very small proportion even. It's not like major disproportion, even a tiny fraction. It can actually distort your blood supply. It can also distort the balance. So अगर वो ज़्यादा right को जाती है, left पे थोड़ा सा hole खाली रह जाता है, that also prevents you from having your weight to the left, and you tend to put a lot of weight to your right, जिससे ये होता है कि you start using your right side more than the left. So these things, and it can also cause inflammation. बहुत ज़्यादा सूजन पैदा कर सकती है वो. So slip disc is another thing. Unfortunately, a lot of people tend to think a slip disc ka ek hi ilaj hai, which is surgery. I'm not saying that's the don't go for that approach, but I think that should be the last approach that you should seek. There are so many other things that you can use. There is massage out there. I said earlier, there's osteopathy, there's acupuncture, very good one for slip disc especially. And along with that, you can use homeopathic remedies to treat you internally, not just physically, but internally, to overcome those issues. The next one I wanted to talk about is a frozen shoulder. Again, as I said, back starts all the way from your neck to your lower back. Your shoulders this is when you have excessive use of ice. You strain your neck and shoulder area a lot. It can cause from whiplash injury, where your shoulders tend to feel as if they are frozen, and they lose sort of sensation in them, and they're not flexible anymore, and you sort of feel a lot of tension and soreness in your shoulders. Again, this is something that can be relieved using good massage with the right aroma oils, and you can also use remedies to ease off that pain. One thing I really want to focus here is back pain that can be caused because of leukorrhea, and that's when I was talking about the food that you intake. The food that you intake is responsible for giving you new cells regeneration, for your blood production, the quality of blood. So if you keep your food healthy, it allows you, आपको chance मिलता है कि आप अपनी diet से अपनी जो blood है वो you produce high level of high quality of blood. Now, leukorrhea is a problem that is quite common in women. And that is a way, if it's normal, it's okay, and you tend to have it during pregnancy or premenstrual. But if it's something that carries on for a long time, and it's not in a specific period of time, it's actually there all the time, then it can become problematic. And a very adverse effect of it is actually having a back pain. A lot of women suffer from back pain because of that, and that is only because your bones start to weaken. You do not have enough supplements and nutritions in your body to cause a regeneration of your bones cells, and to allow your body to be stronger. And you sort of tend to, and by the way, this approach is herbalist approach. The principle that I'm talking about, you tend to lose your energy through that. So it's extremely important that you take right supplements, you take right nutritions, and I mentioned that in my previous program as well. For a woman, it's extremely important to make sure that your diet is healthy, to make sure कि आप जो nutritions or supplements ज़रूरी हैं आपके लिए वो आप take कर रहे हैं, because if you don't, eventually your body is going to wear out, unfortunately, and once it starts to wear out, it's going to have effects on you mentally, emotionally, and then physically as well. And again, unfortunately, जब तक physically effects show नहीं होते हैं, we tend to ignore things. And in homeopathic point of view, your physical symptoms, मतलब जब आपको physically problems होना शुरू हो जाती हैं, that's the last point of call. It means that things have been let go for a very long time, and they need to be addressed. So this was the whole the whole sort of the generic approach to the treatment of back problem. One more thing I want to mention here is the back problem can be relieved by, as I said earlier, by using the yoga and the Pilates classes. It is extremely important to keep some sort of activity going, because sometimes there are two types of people that I've come across who tend to have back problem. एक वो लोग हैं जो extensive work they have done, and work, I'm not talking about just working somewhere, I actually mean at home. You know, all those ladies out there who work at home, बहुत ज़्यादा देर तक खड़े होना, बहुत ज़्यादा देर तक you know, not being able to rest, especially through your pregnancy, can cause major problem. As I said, having a back problem during the pregnancy is quite normal, but if it is persistent and it's coming up with those symptoms, you're losing weight, you're finding that parts of your body are swollen, you're finding that even while resting the problem is, the pain isn't easing off, then these are the signs that there is an issue. So you need to sort of address that issue. And if you're someone who has you know, even in your most sensitive part of your life, and you're expecting, you have been working hard, you know, whether in job or at home, you've been straining your backbone, you know, you will have problems with your back. So it's extremely important. One thing I also would like to mention here, which I did say in the start of the program, is other reasons that you can cause problem. So one being, you know, very basic, being your posture. Then you can, a lot of people develop back problem in their pregnancy, and then it lasts even after it, post-pregnancy and you know, post-childbirth. And then it becomes persistent, and it has a periodic cycle. It tends to come back during your when you're bearing the child, and then it goes away. Sometimes it just stays up, you know, for forever. So it has a pattern to it, and you need to find out what the pattern is and then seek medical advice accordingly. The other issue that can cause the back problem is if it's especially in your region of kidney. So where your kidneys are, and I'm sure you all know, if you just put your hands right at the back and touch where your waistline is, this is the region where you have your kidneys, just behind your sort of on the corner of your waistlines on both sides. And if you have a back pain just over there, so just going backwards now towards your backbone, if that's the region जहाँ पे आपको दर्द हो रही है kidney के बिल्कुल साथ parallel, then that tells you that there is a problem in your kidney maybe. What happens is, I'm sure you all know कि गुर्दे kidney मतलब गुर्दा जो है हमारे जिस्म में, उसका काम है कि जो टॉक्सिन्स हैं बॉडी से उनको रिलीव करे, मतलब जो फाजिल मादे जिस्म के अंदर होते हैं उनको रिलीज करे थ्रू योर यूरिनरी सिस्टम. बट अनफॉर्चुनेटली अगर फॉर वट एवर रीज़न वहाँ पे कोई प्रॉब्लम है एंड जो आपके सारे टॉक्सिन्स हैं वो वहाँ पे जमा हो रहे हैं एंड दे आर नॉट बीइंग रिलीज्ड फ्रॉम योर सिस्टम, then that can cause problems in your backbone as well. As I said, जो bone है itself वो हड्डी है, लेकिन उसके अंदर cells generate होते हैं और उसको proper blood supply मिलती है through the sponge discs. So अगर वहाँ पे जो खून आ रहा है उस हिस्से के अंदर वो खून बहुत ज़्यादा फाजिल मादे contain करता है, then it simply means that you're not going to have healthy blood supply. So it's going to have over a period of time, it's going to affect your backbone. So if you are someone who is suffering in that region, one point of call would be to maybe check if your kidneys are and your the way your body is getting rid of the toxins is working out. So the other thing I wanted to mention is when you start to have a pain in your gynecological area, and by that I mean the pelvis, especially for women. I mean the womb area where you have your ovaries, your fallopian tube, your uterus, uterine area. If you're having problems in your uterine area, then that just means there is some sort of disorientation. Now every human, when we are born, the organs within our body are supposed to be on one particular place, and if they are not on that place, they are disorientated, then that can also cause problems. So अगर आपकी बहुत ज़्यादा मसला है back में, especially your lower back, मतलब जो pelvis, at the front you have your pelvis and just behind it, अगर उस region में आपको मसला हो रहा है, then that is probably because of the disorientation of one of your organelles from your within your pelvis. Then you need to get that checked. Other times when women tend to have back problem is premenstrual and postmenstrual, and it is very, very normal to have pain at that time. But when I'm saying normal, please bear in mind it is only if it's for a period of time, as in like few weeks, a few days before your time of the month and few days after it, or just between the along that time. If it's consistent after that particular period of time, then you need to address that, because it's not normal. Then it should either be just before or through the time, but not long after it. In that case, you can use some homeopathic remedies, and again, for that particular type of problem or back pains, there are very, very successful remedies available out there, जो कि मैं डिस्कस करूँगी और जो कि मैं आपको बताऊँगी some of them, जिस वक्त we will discuss the premenstrual and the postmenstrual symptoms and problems related to that. Now, going back to our back issues, what I said, there were two types of people. एक तो मैंने आपको बता दिया जो कि बहुत ज़्यादा exertion, extra activity, because of those reasons they tend to develop a problem. But other type of people are जो कि बहुत ज़्यादा rest करने की वजह से उनको problem हो जाता है. So it's very, very important to be active in your life, basically. And the best type of exercise that I can tell you is yoga and Pilates. The reason I'm choosing those two is because not that they only give you a chance to sort of maintain your health, as in maintaining your good healthy weight, but also that they help you to better your posture as well. Yoga and Pilates both are extremely good exercises to make your posture better, and they also give strength into your muscles, so they make your muscles stronger, they increase your stamina, and they make your posture really, really good. So it's not just there for the sake of the health, but also if you're willing to have a good posture and make your bones last for longer, for a lifetime, then definitely do seek some of those classes. Now, it's quite obvious to understand. It's quite obvious if you use something over a period of time, it tends to wear out, and this is how bones are. कोई भी activity shouldn't be for too much time. एक routine के अंदर नहीं होनी चाहिए. It's obvious, अगर आप कोई भी चीज़ extra use करेंगे, it's gonna wear out eventually. So as I said, if you are taking too much rest, then you need to do some activity, and if you're doing too much work, then you need to slow down a bit in order to help you. But these are just the general things general precautions that you can take. Apart from that, as I said, you need to see your GP if you wish to resolve those backaches, and you need to go and visit them. You need to discuss with your GP the issues you have. I'm sure a lot of you do, and if you're taking only painkillers to help your back, then it's not sufficient. It's not going to get you anywhere. You need to actually treat the cause of the problem. And as I've said previously, a lot of people I have seen tend to have back problem. In my practice, I have seen people having, for example, I know someone who had a whiplash injury, and since then they developed a back pain. And the back pain would get so worse that they were nearly paralyzed, and they will find it difficult to even maneuver for daily life, in order to do their daily life chores. And what happened is at the end I found out from, by doing the consultation and the analysis of the patient, that it was just simply a shock. So all they needed was to a little remedy to help them get out of the shock, because their body hadn't recovered from it. And then eventually, over a period of time, with some physiotherapy and with some Pilates, they just got rid of the back problem. Unless someone has paralyzed and it's gone to an extreme end, it can be reversed back, because back problem is something that can be reversed back. It's not something that cannot be brought back. The time has actually flown by. I didn't even realize, and the hours passed by. It's been a pleasure to be here and make all of you aware of the problems that you may be facing. I will be here again on Tuesday, next Tuesday between 5 and 6. Please make sure that you tune in. I will be here with a new topic, and you can call and interact with me in that program. Do take care of yourself and the people around you. Assalamu alaikum.
Are you having a trouble to access the online Quran? The Quran Easy Way gives you the one-to-one, the family packages, and the professional ones.
مولاي صل وسلم دائما أبدا على حبيبك خير الخلق كلهم يا ربي صل عليه يا ربي صل.
Book your first trial today on www.easywayquran.com.